Here with more on the vaccine rollout starting today is Dr. Gabe Callan, Director of Emergency Medicine at Johns Hopkins Medicine in Baltimore. Dr. Callan, it's great to see you this morning. Thanks for being here on Quick Take. Healthcare workers like yourself will be among the first to get the vaccine. What has been the willingness from healthcare workers who you're around so far to do so?
It's been surprisingly strong. We had also thought that, much like what was recently published on the willingness, about a third fairly willing, a little more than a third. All right, let me see if somebody's arm falls off first, and then maybe I'll get it. And then some people who don't want to get it, there may be some cultural resistance to it as well. But so far, we announced the availability of vaccine just late last week and the ability to start signing up for it. And the response was immediate and very strong.
So do you know when you'll get it?
I don't, because we're doing our randomization scheme for the top tier, actually a little bit later today. And I'm just in the pool with everybody else. And if I get a ticket, then it's beam me up, Scotty. I'm in line.
You're in line. You'd be willing to take this thing today if you could.
Yes, oh, absolutely. I have no doubt about the likelihood of its effectiveness. The ingredients in it are purer than most of the food that most of us eat and are willing to put in our bodies, so I'm not too concerned about what's in it. The side effects are reasonable for me. Understanding long-term side effects of vaccines in general really do not give me any dyspepsia whatsoever.
Given that we are starting to see the first shots roll out today, Doctor, and they will go to people who are among the most at risk, when would be a realistic time that we could stop seeing these numbers rise, when we could actually start to see them fall? Because the people who are the ones dying in the hospital from COVID are the ones who fit the profile of those who should be getting the vaccine ASAP, right?
Yes, so we're not going to see an immediate impact. First of all, the vaccine is still in what we would call scarcity. It's not reaching the general public. It may have a small impact in that it's going to nursing home patients and the elderly, but so many precautions have already occurred in the nursing home situation that's just an added tamp down. It's the general population that needs to get it. So we're going to see this surge regardless of the vaccine availability, because it's just not going to get to the public in the next 1 or 2 months.
I want to get your take on something that John Lauerman, our previous guest, just talked about. It was referencing this report in the New York Times yesterday that members of the Trump administration, people working in the White House, would be getting the vaccine. President Trump pushed back on that, saying that that is not, in fact, going to be happening in the coming days. It will go elsewhere. But what are healthcare professionals saying about people who have already been infected and recovered from the coronavirus, who may have immunity, also getting the vaccine?
Well, we don't know exactly what kind of immunity a natural infection implies. And there are many cases where natural infection is actually weaker in terms of long-term immunity than getting a vaccine. So it is strongly recommended that even if you were infected previously, that you get this vaccine.
All right. Dr. Gabe Callan in Baltimore, thank you as always for your time, Dr. Callan. We should note that the Johns Hopkins Bloomberg School of Public Health is supported by Michael R. Bloomberg, founder of Bloomberg LP and Bloomberg Philanthropies.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.